Ladies and gentlemen, it's a real pleasure to invite our next guest back to this stage at the 42nd Annual Cancer Control Society Convention, Labor Day weekend 2014, Universal Sheraton Hotel in Universal City. Dr. Brad Weeks has been a while, but always happy to have him. One of the interesting things, he happens to be a board-certified psychiatrist, and we have a number of other people in this movement that board-certified psychiatrists that know both sides of the medical spectrum. He's very often a presenter at the professional conferences, and yet we like him because he can also take those concepts and talk to them, explain them to everybody. We've heard a lot about inflammation and cancer, so it's a real pleasure and a privilege to have Dr. Weeks here with us. Brad, thank you. Thank you for being here.
All right. It's my pleasure to be here. Thank you. Lorraine, wherever you are, 42 years, you know, that's a long time to be serving her fellow human beings. Frank, thanks for your help. All right, yeah, Lorraine. Well, I'm going to be talking about inflammation and cancer today, and I hope I'm going to be surprising you a little bit. This is maybe going to surprise you. I see this. Do you see that? Chuck, are we okay? I have been surprised before. Chuck, shall I do anything on this, or should I just keep going? I'm seeing it on your computer, but not up front. By the way, Chuck, thank you very much for making it all happen. I love it. While I've got your attention and Chuck is fixing this, I'm going to pretend to take a call from somebody with my cell phone and with my handset. Because you all know that when you activate your cell phone, if you look at page 4 of the iPhone 4 manual, it says you should never have it on and closer than 5/8 of an inch to your body. Because they know this is a very dangerous instrument. So please don't put this up to your head when it's on.
It's here, but it's just not up on the screen.
Yeah.
We're not getting PowerPoint on the screen.
So,
first slide.
yeah. So I gave a lecture recently in Japan on cancer after Fukushima, and I tried to clarify that it's one thing to help everyone who's been battling Fukushima radiation. It's another thing to let all the kids be doing this all day long. All right. Thank you very much, guys. All right. Sorry for that delay. Inflammation and cancer is my topic. The bottom line is that inflammation is both good and bad. So we're going to come back to that. This is a nice graphic of how popular this Cancer Control Society has been. Here's a grandma trying to get in, and there's no more room. It's too popular a movement, saved thanks to Lorraine and company. This was on this morning's Wall Street Journal. Doctors are unhappy, and it's hurting the patients. Why are doctors unhappy? Doctors are unhappy in part because, especially if you're in oncology, you're not really helping people. You might be well-intended, but you're not really helping people. A couple years ago when I gave a talk here, I asked for a show of hands of everyone who knows someone who's died of cancer. Can we do that again? Show of hands. And of course, you're all being fooled because you don't know, God bless the deceased, God bless the suffering, you don't know whether the cancer killed the person or the chemo and radiation. And it's very, very clear, if you're thinking scientifically, you can't separate the illness from the very dangerous treatment. When you look at the research, most people are clear that radiation and chemo are more dangerous than cancer. I'm not going to make that the topic here, but I want you to know that cancer is not a happy thing for people to be dealing with because the treatments are ineffective. There's other helping professions out there. Here's a gentleman at the Burlington, Vermont airport. I saw this poster. Here's a shoe shine guy who donated $100,000 in tips to kids. I just thought this was wonderful. You don't have to be a doctor to help people. And if you're going to be a doctor, you ought to focus on helping people and not just on helping Big Pharma. So we're thinking outside the box today. I like this graphic. This fellow was asked whether he's drunk. Yes, no. He couldn't even hit no. The fact of the matter is we are thinking outside the box. And God bless you all for being here to do that. It takes a lot of courage. Now, the problem with the standard of care in the war on cancer, we don't have to go into a lot of details. I'm sure you've heard that, but since Nixon, in December 23rd of 1971, since Nixon declared war, it's been abysmal. We know that 2% of all cancers respond to chemotherapy, and conventional chemotherapy hurts more than it helps. What we know is that the overall contribution of curative and adjunctive chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia, 2.1% in the US. 2.1% benefit by chemotherapy. These are the facts. This was published in the Clinical Oncology Journal. This is not alternative medicine. Chemotherapy makes only a minor contribution to cancer survival. I'm going to explain why that is today. Here's a name you should remember, Max Witch, a distinguished professor of oncology, University of Michigan Comprehensive Cancer Center. Nothing alternative about Dr. Witcha. Nothing alternative. When Obama signed the stem cell bill, he gave the pen to Max Witcha. Max Witcha is on record as saying, chemo and radiation make your cancer worse. He also says the problem is when we treat cancer cells with chemotherapy, the cancer stem cells are being stimulated to grow too. Okay? Chemo and radiation unequivocally make your cancer worse. Now, but my tumor shrunk, says the patient. I took chemo and my tumor's half the size now, and the oncologist is pleased. The tumor shrunk. Well, Daniel Haber, director of Mass General Hospital's Cancer Center, says tumor shrinkage does not correlate with survival. These are troubling things to think about. This doesn't make an old doctor like me very popular. Because I'm one of the few certified instructors in insulin-potentiated chemotherapy. I'm one of the few doctors that can teach other doctors. But I've moved away from chemo because even low-dose targeted chemo is not your best option. The new target has to be the cancer stem cells. Our ultimate goal, says Dr. Cho at Stanford, is to come up with a therapy that knocks out cancer stem cells. That's not cancer tumor cells, that's cancer stem cells, different critter. If you irradiate a tumor and kill a lot of it but leave the cancer stem cells behind, the tumor will grow back. You have to be thinking about cancer stem cells. Now, that's not my topic. I've given prior lectures on this. I talked about that 2 years ago here. You're not going to write these down, but you'll have access to it at weeksclinic.com. The references and the science is very clear. Prior lectures. I have also talked here in the past about bee venom therapy and apitherapy. What is apitherapy? Bee venom therapy is a very powerful inflammatory agent and also an anti-inflammatory agent. It's both. You'll see that natural products have the yin and the yang, the inflammation and the anti-inflammation. A lot of references at weeksmd.com on bee venom and cancer. Here's a little reference to bee venom and prostate cancer. This was published 3 years ago. Basically, bee venom suppresses an NF-kappa beta. It's an anti-inflammatory. It also stimulates the induction of apoptotic processes in cancer cells. So bee venom, very beneficial, very seldom talked about. Honey, may prevent recurring tumors. A lot of these studies don't happen in America. This happened in Turkey. Provocative study shows that using honey can prevent colon cancer coming back. All 30 mice treated with honey developed tumors. Without honey developed tumors compared to only 8. So again, a lot of things to do. We're not talking about that today. We're talking about unpleasant truths. So what about the old men? Why don't they get hired? At a job interview, the human resource manager says, "What's your greatest weakness?" And the old man says, "Honesty." And the resource manager says, "I don't think that's a weakness." The old guy says, "I don't give a shit what you think." So here you are. You are outside the box. You're learning something new today. So let's keep going here. We'll have some fun. The goals for this presentation is to clarify the dual roles of inflammation, to clarify the role of anti-inflammatory agents in corrective cancer care, and I'm going to share some protocols about the therapeutic effect of stimulating acute inflammation while suppressing chronic inflammation. What about inflammation? We now know that it's not just a painful joint. It's the driving factor behind the aging process. We now call it inflammaging. It underlies all major degenerative diseases, cardiovascular disease. Here's the kicker. All cancer metastasis is driven by inflammation. We heard Dr. Contreras before say the primary tumor never kills anybody. He's mostly correct there. The primary tumor is not the problem. It's the metastatic tumors. Those are driven by inflammation. You'll see that Max Witcha and other doctors are saying, researchers in oncology, that the future of cancer treatment is anti-inflammatories. It's also a treatment for schizophrenia. This kind of shocked me. I'll come back to that, but inflammation drives all chronic illnesses. Russell Tracy, University of Vermont College of Medicine. Inflammatory factors predict virtually all bad outcomes. So I'm wanting you to work with me and agree that inflammation is bad, because in a minute I'm going to tell you that inflammation is good. So I'm going to have a little bit of a conversation, I hope. Psychiatric Times, January 2014, add anti-inflammatories to schizophrenic treatment. How amazing is that? These findings create a vision of a rational, adjunctive, anti-inflammatory therapy to quench the fire in schizophrenia. This is out of Harvard, anti-inflammatory agents in cancer care. If you interfere with inflammation, that is a new strategy to block breast cancer self-renewal and progression. So I'm not the only one saying anti-inflammatories. Now, what is inflammation? Let's think a minute. Inflammation is a symptom. And Hahnemann, Samuel Hahnemann, the father of homeopathy, says all symptoms are healing gestures. A fever for a child, that's very therapeutic. When I was on the cancer wards at Dartmouth, and I had to go, I was called at 2 in the morning to go give Mr. Jones triple antibiotics because he had cancer and he had a fever. I hated doing that. I felt like a Gestapo guard because I knew that that fellow having a fever at 3 in the morning on the cancer ward was his immune system kicking in and trying to fight the cancer. Don't go suppressing fevers. Too much of a fever will give you a Helen Keller, very tragic. Too much of any symptom can be problematic. But symptoms are healing gestures. Please hold on to that as a theme of this talk. Now, Hahnemann was a brilliant man. This is a picture of yours truly with the statue. It's almost one of my favorite places to be in Washington, D.C. So what are the benefits of inflammation? I've told you that inflammation is bad, it drives cancer. What are the benefits? Of course, you dilute the toxins because you have a lot of fluid coming in. You increase pain with inflammation. That limits motion, so you start to preserve the joint rather than destroy it. You get increased vascular permeability. The leakage allows for blister formation, coagulation of fibrinogen. White blood cells can muster to the area and create what's called a noble pus. Beneficial, and most importantly, inflammation gives you interleukin-6 and interleukin-8, which what they do is they can go and they can recruit benign stem cells to come to the area of injured tissue, whether it's a broken bone or a gastric lesion. Inflammation recruits benign, uncommitted stem cells to come to the area of injury and to repair. If you're not familiar with that, that's critical. Cancer stem cells are bad, regular stem cells are good. Regular stem cells are recruited to come to the area of injury by inflammation. So that's a beneficial thing. The problem is if you're giving chemo or radiation and injuring a tumor, it sends out that same SOS, and it recruits benign cells, stem cells, to come to the tumor and make what? Make more tumor. It's a little bit of a fast transition, but work with me there. Inflammation brings uncommitted stem cells and makes them into cancer. If the tissue you're injuring with chemo or radiation is tumor, the stem cells will make more tumor. Lord Shiva the Destroyer. This is a beautiful process. In the Hindu religion, of course, Shiva is the destroyer, Brahma is the creator, and Vishnu is the preserver, after which Brahma again creates the world for new cycles. This is what happens in health. We need inflammation to break down systems so that we can then have regeneration. You don't get anabolic regeneration in healthy tissue unless you've had inflammation to destroy the tissue. It's the same with bones. So inflammation through the ages, this is kind of interesting. Hippocrates says it's a cooking process, and then there's a discharge and excretion. If I had more time, I would read all these slides. I'm not going to do that. I'm just going to give you a quick look at it. But Hippocrates valued inflammation. Celsus and Galen talked about inflammation being tremendously important. In the 1970s, even Virchow, our father of cellular pathology, said inflammation is a protective process. And yet you're hearing me say with one side of my mouth, inflammation is bad. Okay? So we have a question here. And so historically, inflammation was good. Cancer was helped by the fevers and the inflammation. But let's look, okay, now let's look at inflammation and cancer in the 19th century. Inflammations do not arise spontaneously, but they heal spontaneously. This is beautiful. Tumors arise spontaneously, but they do not heal spontaneously. It's kind of interesting. This is going to be a talk where you have to think with me. I'm apologizing about that. Inflammations do not arise spontaneously. That's because they're a symptom, a healing gesture. But they heal spontaneously if the body's healthy and nourished. Tumors arise spontaneously, but they do not heal unless you have the appropriate inflammation. Then Labotte pointed out in 1896, you just don't get cancer if you have an inflammatory process happening. 1910, Schmidt showed that if you had childhood diseases with a lot of inflammation and febrile illnesses, you didn't get cancer. That's an active immune system. The destruction of the cancer by the cells of an inflammatory metabolism is clearly shown. This is Huseman and Wolf. If anyone hasn't heard of anthroposophical medicine, that's a fountain of my knowledge base, Rudolf Steiner's work in medicine. The carcinomatous metabolism appears in just those places where the body is no longer capable of an active inflammation. The body is using inflammation to keep cancer down. Inflammation and cancer. In 72 leukemia patients, this doctor found that in the ones that had pneumonia, they didn't have the cancer. So what we have really, according to Wolf and Huseman, is you have, in avoiding the problem, the cilia of infectious disease, we steer toward the trabdis of malignancy. So you've got these balances. Too much inflammation is bad, too little inflammation will get you cancer. But what's the modern view? The modern view is very different. The modern view is inflammation is bad, it makes cancer worse. We have statements like Robert Weinberg, really the father of modern cancer work, says the connection between inflammation and cancer has moved to the center stage. We have in terms of asbestos work, they found that it's a role of inflammation which causes the asbestos-induced cancers. We found, according to Balkwick, that inflammation alone accelerates cancer proliferation. This is nice. Cancer researchers since 2007 understand and acknowledge that the fundamental prime cause of cancer is inflammation, not genetics. Inflammation and cancer, I'm kicking a dead horse here, but we're talking about there's a growing body of evidence supporting the role of chronic inflammation with prostate carcinogenesis, so you need anti-inflammatories for the prostate. Here we see a lot of inflammation and cancer in terms of fish oil, which is supposed to be anti-inflammatory. We see no protective benefit for prostate cancer. That was very mystifying. Marine oil, it turns out to be highly inflammatory, therefore cancer-causing. Marine oil, fish oil capsules. I hope Patrick's in the room. The consistency of these findings suggests that these fatty acids are involved in prostate cancer tumorigenesis. So we have to be cutting down on fish oil, increasing our seed oils. Now, it's worth reading this. While the genetic changes that occur within cancer cells themselves, such as activated oncogenes or dysfunctional tumor suppressors, are responsible for many aspects of cancer development, they are not sufficient. Oncogenes, not sufficient. Tumor promotion and progression are dependent upon ancillary processes provided by cells of the tumor environment that are not necessarily cancerous. It's an inflammatory process. So cancer is inflammation. It starts by inflammation, DNA damage, spreads by inflammation, breaking out, metastases, grows by inflammation, angiogenesis, and it metastasizes with these interleukins. So anti-inflammatory agents are the treatment of the future. So I ask you, is inflammation helpful or is it harmful? Let's look a little more closely, because it's both good and bad, better or worse, depending upon, if you remember that symptom is a healing gesture, depending upon whether we're talking about chronic or acute inflammation. So if symptoms are healing gestures, I've argued in prior lectures that cancer itself is a symptom of a process which is not healthy. Cancer is not the disease. Cancer is the symptom of the disease. And I would suggest we consider that cancer itself is at least a warning signal, if not a healing gesture. We're going to look at chronic and acute. I'm going to propose that chronic inflammation is immunosuppressive and carcinogenic. Acute inflammation is immunostimulating and restorative. So how can we make the human organism able to have the appropriate inflammatory response? This is really beautiful literature. I'd like to read it all, but we don't have time. So I'll just say that they found that the inflammation found around the tumor is always chronic in nature and arises not primarily but as an insufficient reactive attempt by the organism to reincorporate the proliferating parts. Rudolf Steiner says, this attempt, however, must fail as long as the fever formation is inadequate, as long as you don't have enough acute inflammatory capacity. Fever formation, that is, so long as the ego and the etheric body do not engage in the metabolism and restructure this unorganized cancerous life. For this engagement and structuring, especially on the part of the ego, a sense of appreciation, a sense of meaning in life, a sense of purpose are critically important to people with cancer. We know that. A lot of cancer patients will say, I want to live until my son graduates from college in 5 years. They make it until then, and then they die. We need to have this ego organization. We must repeatedly emphasize the critical significance of warmth for an undertaking of cancer and its therapy. Warmth, and by that he means enthusiasm, purpose, meaning. So in the picture of inflammation, the catabolic aggressive character is the more imposing side, and the anabolic formation of new tissue is less noticeable, especially if you have a more dominant chronic inflammation. Okay, all I want to say there, that's heavy stuff. That's Rudolf Steiner. That's heavy stuff. I just want you guys to be thinking with me that you need both the destroyer, you need Lord Shiva, and you need the creator. You need the destructive catabolic, and you need the anabolic. I like this. Rudolf Steiner says, in order to understand how to deal with chronic processes, the ego is not sufficiently interested. You're not permeating. Everyone talks about mind, body, and spirit, but what does that mean? You have to permeate your organism with your ideas, with your thoughts. And so the art of the physician is to reawaken the interest of the organism or the ego in this chronic process, to reestablish dominion over your own body. Now, the human body, and not any remedy, the human body is the miracle worker. We are fearfully and wonderfully made, the Bible tells us. The human body is the miracle worker. Our role as the physician is just to nourish it and to detoxify it. And also, as the physician, to inspire your patients. Bernie Siegel, 30 years ago, told us there's no such thing as false hope. He's right. Inspire your patients. What is humanity's greatest invention? It's, of course, the thermos. It keeps cold things cold and hot things hot. How does it know? I give you that old joke because the body knows what to do in terms of acute inflammation and chronic inflammation if you'll just nourish it well. Like the thermos, the body knows how to heal itself. So let's talk about commonly used anti-inflammatory agents. I'm not a fan of these. Prednisone, the cortisone drugs, non-steroidal anti-inflammatory drugs, ice pack and cold packs and so forth. And the side effects of those are, of course, immunosuppression, retarding of the healing process, GI bleeding, pulmonary bleeding, interference with clot formation, and death. Recently it was published that 45 deaths a day and over 3,000 over the past 30 years from prescription pain medications. So here's Monsanto, 1991. Chew on the bark of 2 willows and call me in the morning. I like that. Monsanto was on the right target back then. Here is Max Wicha. I mentioned him earlier. He's the one who said chemo and radiation make your cancer worse. He says you need an anti-inflammatory to treat cancer. Other ones like aspirin, buffer, and metformin or berberine, lifestyle interventions, dietary interventions, including eating the seeds, which I'm going to tell you about, but vitamin D and so forth, anti-inflammatories. Aspirin is a sensible option, and basically they're saying you can reduce the cancer incidence by 55% by 55 months in carriers of colorectal cancer. Aspirin works to prevent and treat cancer. Not alone because what happens is too much aspirin kills people. Here we have the 1918-1919 Spanish influenza. Turns out that aspirin was killing people more than the influenza. They were giving up to 31 grams per day, and they were getting pulmonary edema. So it was aspirin, it was iatrogenic, which was killing people in the Spanish flu. We do corrective cancer care. That involves nutrition, exercise, and thought. Instead of the conventional remedies, we give immune enhancement, nutritional supplements, detoxification, oxidation, anti-inflammatory agents, and bee venom therapy. We take down the cancer welcome sign. We reduce chronic and we increase acute inflammation, lifestyle changes, correct thinking. And here's how we do that in part. We invite people to dine at the VIP dining club of Mother Nature, the most exclusive and most nourishing banquet. And folks, that's eating the seeds. If you eat the seeds, you eat concentrated nutrition. They have to be organic and non-GMO because seeds, being oily, will concentrate pesticides. Organic seeds. But in this meal, most people eat this and don't eat this. Here's what I had for breakfast this morning. Upstairs, they gave us Smucker's, seedless blackberry jam. The grapes were seedless. In America, we throw away the seeds. The seeds are the most concentrated nutritional component of any food. What is a seed? 20-fold more nutrient. It's got 100% complete food. It's going to do what it takes to reproduce. The husk is the most nutrient-dense aspect of the whole seed. Don't just eat the seed oils, eat the husks. They're full of polymannose. And the seed is loaded with DNA and RNA. Whatever the seed was going to put into making a new plant, you get that DNA and RNA as your spare parts. Eat the organic seeds. Here's a graphic which shows that they're much more valuable than the fruit. The seed husk CD14 cells stimulates adult healthy stem cell behavior. CD14 cells are in the husk of the seed. You don't get that if you're just doing the seed oil. Genetics 101, we have these spare parts in the seeds. This is my father, white hair, turned black again by eating the seeds. All right, Mother Nature does put all her eggs in one basket. It's called a seed. Choose them wisely. Black cumin, 281 times more potent as an anti-inflammatory compared to aspirin. It stimulates p53, which is the tumor suppressor gene. It also inhibits chemotaxis, multiple myeloma cells. It prevents cancer metastasizing. The connection between inflammation and cancer is very clear at this point. When you take the black cumin seed, basically you produce a greater effect with the chemotherapy and less toxicity. Okay, you eat the black cumin seed, the whole seed, not just the oil, it makes chemo more effective. Black raspberry as well. You want to get organic, raw, unoxidized. You want to freeze them before you grind them, add them to your meals. Sole is a product which has all that in it. A lot of people have sampled that today. ORAC value is off the charts. The anti-inflammatory mechanisms are clearly elaborated in this product. So, just to summarize, we need both inflammation and anti-inflammation. Excessive or chronic of either is not healthy. The balance of inflammation depends upon the health and nutritional inventory of the patient. Treat the patient, let the patient treat the cancer. Eat organic seeds. Addressing inflammation is the new frontier in cancer, tumor, and cancer stem cells. Don't forget to ask your doctor to treat your cancer stem cells. It's time to doctor them, and people are starting to hear this. So the future of cancer care is anti-inflammation. I'll end with Henry David Thoreau saying, "I have great faith in a seed. Convince me you have a seed there, and I am prepared to expect wonders." Thank you for your time. Eat the seeds and treat the patient, not the cancer.